Intraoral scanning for dummies. Hi everyone, it's Angus Pryor here, #1 Google ranked dental marketer in Australia. We're at the Digital Dentistry Conference and I've got a special guest here. Just heard an awesome presentation from Dr. Ahmad Al-Hassiny. Welcome Ahmad, how are you?
Very well, thanks for having me.
That is honestly one of the most interesting presentations I've ever heard about something that's a super hot topic. So let's start right at the beginning. Your initial pitch in your presentation is dentists should be doing intraoral scanning. Why?
These days there's just no reason not to. I mean, the primary barrier for dentists getting into intraoral scanning has always been cost. And the cost is basically going from 60k as an entry fee to these days down to about 18k. So the costs have completely plummeted. Then you have to consider what are the actual benefits of this stuff, and they're just endless. I mean, everyone's heard them before. Scanners are faster than impressions, they're as accurate, if sometimes more accurate, they're much more comfortable, they open your scope of practice. There's just so many reasons to get into it these days.
Yeah, and I'd have to say, as a patient, my dentist used one and left a picture of one of my teeth about the size of a soccer ball sitting on a screen in front of me, you know, and I'm looking at this thing while he's talking to me, and he says, "Oh, Angus, there's something wrong, but we don't need to get to it now. Maybe we can do it a bit later." I've been looking at this thing for the last 2 minutes, and I'm like, how do we fix that thing?
So that's the thing. A lot of dentists, when they think about getting into a scanner, they're like, "Oh, ROI, how much is it going to cost? How much does the impression material cost?" But there's so many other benefits, such as the wow factor, the trust you build, and also just improving communication. Like, there's so many apps these days and softwares in the scanners that enable you to improve your communication skills and improve your treatment plan.
I would say for me, he didn't need to say a word. I was sold. I was saying to him, how do we get this fixed, rather than him having to do any selling at all, which you definitely want. Now, one of the things you mentioned in your presentation, you said basically most scanners these days are reasonably fast. There's not an issue from that point of view, but a little bit contentious. The problem is actually the scanning ability. Tell us about that.
So yeah, look, I mean, these days the hardware of all the scanners has basically all come together as one. 10, 15 years ago there was very clear differences in scan speeds. Now, look, I've used over 17 intraoral scanners and I can achieve full arch scans under 60 seconds with all of them. So speed is not really the key differentiator, and in terms of actually how to use them, what it comes down to is just training, because the reality of the situation is when you buy a scanner from your sales rep, a lot of the time you just get a day or two training and then that's it, and you're on the lurch. And oftentimes I find through my training with dentists that they don't actually understand how to use it. And what I would say, not limitations, but when you need to be extra cautious when using a scanner.
Okay, and I know you mentioned 3 common challenges. One was trying to scan over the top of saliva or blood, so it's not dry. I'm trying to remember what the other 2 were. One was
blood and saliva, basically not controlling the fluids well enough. I mean, a scanner is an optical device, so the area that you scan needs to be dry. The second thing is just poor retraction. Dentists, just for some reason with scanners, think they don't need to place retraction cord anymore and displace the gingiva. Now, when you have margins on your crown that are above the gums, that's fine. But a lot of the times you've got subgingival margins, you really need to control the gums. And thirdly is just not using the right strategies when you're scanning, just poor technique in scanning.
Okay, all right. Now, the truth is, you and I are trying to squeeze an hour-and-a-half presentation into a 3-minute video. We can't do that. You've very helpfully got something called the Institute of Digital Dentistry, instituteofdigitaldentistry.com. There's a whole stack of resources for people there who are thinking, all right, you've piqued my interest. I know I should be doing this, but I haven't done it. You've got a whole bunch of stuff there to help people actually choose which is the best one.
Yeah, so I mean, a lot of those resources on our website is completely free. So we do objective scanner reviews.
Yeah, no sponsorship. No sponsorship by any
objective. And these are all online for people just to help them choose which scanner is going to be best for them. What we also run is basically like the Netflix of digital dentistry, an entire platform with over 80 hours of just digital dentistry CPD, everything from how to scan properly to how to design the most complicated restoration.
Awesome. www.instituteofdigitaldentistry.com. Ahmad, thanks so much for your time.
Thanks so much, mate.